quality over quantity or quantity over quality? It's the age-old trade-off in IOL technology. But CIFI thinks patients deserve more possibilities. The Mini-Well family of IOLs, including the Well Fusion optical system combining Mini-Well and Mini-Well Proxa, the Mini-Well Toric IOL, and the Evolux were all on display at APAO 2024 in Bali, along with the company's signature wavefront engineering technology. We caught up with the clinicians working with this tech to check out what it's all about.
The modern person demands to see well for far and near and in between. At the same time, they want to see it clearly without any fogs, any circles, halos, and glare. And this Mini-Well line of lenses, as well as the Evolux, provides exactly that. They play around with the positive and negative spherical aberrations, so they counteract each other to produce a continuous line of focus. Now, this is in contrast to a traditional multifocal or even EDOF lens, wherein there are discrete focal points. This system will afford the patient clear vision from distance all the way to near. Depending on which lens that you're using, you can go up to 30 centimeters of very clear vision. Evolux was just sort of like a variation of the same theme of the surface-modified IOL that CIFI started. What is different is that they put it on a monofocal platform and enhanced the surface to allow intermediate vision. And that's what we thought at the start, before we started the study. As we went on, we found that these patients could actually read, not just from their computer distance, but even up closer, up to even 40 centimeters. Of course, there will be some limitations with Evolux, where if you really wanted to see fine print, you would have to use a Mini-Well or a Mini-Well Proxa just to do that. But for a big segment of the population, Evolux will serve very nicely. Patient satisfaction was very, very high. We run these satisfaction questionnaires at the end of the trial, 90 days following surgery, and all of them were very, very high, 90% satisfaction. For the surgeon, he doesn't have to bother with a lot of the pre-op routines, very strict routines that you have to follow when you put in a multifocal or an EDOF. It's a monofocal, so it's a lot more forgiving, and at the same time, it provides what the patient wants.
Well Fusion optical system consists of one eye with the implantation of Mini-Well, and the other eye is the implantation with the Mini-Well Proxa. And both eyes working together, but just to play around with the different zone and the increase of the spherical aberration, positive and negative, to have binocularly wide range of depth of focus from far up to the near distance. In Vietnam, over the last 1 year, we have had a chance to implant the Well Fusion optical system for the patient, and we found significantly great results from the visual acuity and the defocus curve from +1 to minus even 3.5. Neuroadaptation is a process in which your brain reacts to the sensory input, including the sight, the visual sensory input. Because that extended depth of focus is rather than splitting the light, therefore the patient tend to adapt a little bit quicker and have a better visual quality after the surgery, and with less glare, less halos, and also having the very good residual contrast sensitivity. I think Well Fusion optical system can adapt to multiple different areas and professions. When they would like to work with the different distance at once, when they would like to have spectacle-free lifestyle.
Astigmatism actually degrades the quality of vision, whether or not you're using a multifocal IOL. Even if you implant a monofocal IOL and a patient has a residual astigmatism, quality of vision is really worse. For patients who want more spectacle independence, and that's really the premise for implanting a premium IOL or a presbyopia correcting IOL, you'd like to decrease the residual refractive error, and that includes astigmatism. So back in 2018, we were able to recruit around 21 patients. We bilaterally implanted the Mini-Well Toric. We noticed that they had the same quantity of vision as you would expect from the Mini-Well. So in terms of distance, it was actually very good, and they can read up to 40 cm. Around 80% had less than 15-degree rotation post-op. For quality of vision, these patients had very low incidence of halos and glare. After the surgery, more than 80 to 90% actually were very happy with the type of vision that they have. So you really have to probe further if you wanted to learn more about glare and halos, because these patients actually don't know what they are. The Mini-Well has a 4-loop design. So I like it because it's easy to rotate either clockwise or counterclockwise when you're trying to position correction. I also like the fact that you're delivering more for these patients. You're actually correcting not only their spherical or refractive error, but you're also correcting the astigmatism, and again, delivering better quality of vision. Comparing the Mini-Well with other presbyopia correcting IOLs, the fact that it has a non-diffractive platform, I think it makes the Well family of IOLs more inclusive. For example, if you have a patient who doesn't have a healthy nerve or a healthy retina, you can actually go ahead and try to implant these lenses, because again, there's no diffraction, no rings. Take time to explain to the patients what the IOL is, what results they should expect. And I think that would be the perfect setup for selecting a patient for this line of lenses. Well Fusion was basically designed to increase the range from distance up to 33 cm. If you're living in Asia and where the characters are really, really small, then I think it's a good lens to implant. Again, if you're somebody who likes to read a lot and you find yourself looking at small texts all the time, then the Well Fusion is basically a great platform that you can introduce to your patients.
With CIFI's IOLs, these clinician scientists think there are more possibilities than the quality-quantity trade-off elsewhere on the IOL market. And in the end, patients are the winners. To find out more about what CIFI intraocular lenses can bring to your clinic and the patients it serves, head on over to the CIFI website.